I've been involved in the aged care sector basically since I was in primary school. My father was a salesman. He had a run where he would deliver oil products. My mother was a shorthand typist secretary, and they were talking to their accountant in Ashfield one day about, what is a good business to go into. He suggested that people were getting into convalescent hospitals, as they were known at that time. And with the help of my paternal grandparents, my grandfather being a train driver, originally from Bathurst, and my grandmother being a stay-at-home mum, they bought a house in Ryde, which was the last home of the general manager of Avis before they bought it, and they converted it into an 8-bed convalescent hospital in 1962. And my mother was the first cook, and my grandmother was the first cleaner of this 8-bed convalescent hospital. Since then, I used to run around making a mess as little kids do. So since then, I I went to school like everybody else did. In those days, my parents also had a restaurant and a dry cleaners, and I'd been working in those businesses since I was about 13. I had my first job delivering stuff for the local chemist on my push bike after school, or working in the dry cleaners or working in the restaurant. And I was either a coffee jockey or a dish pig or pressing people's pants, so a wide variety of skills. But I knew I didn't want to do that for the rest of my life. And the only way I've got no skills with my hands, I'm hopeless at anything practical. So, in order to get to university, you either had to have rich parents or you got a scholarship. So, I was fortunate enough to get a scholarship. I went to university. I did a double degree in finance and law, and came out as a solicitor in 1977. And then became involved in aged care because the partner that I was articled to, in those days you had to do articles after you finish your law degree in order to become a solicitor. He'd grown up in Glen Innes, and he'd done his articles for a solicitor in Glen Innes, moved to the city. I was employed after he'd been in the city for about 20 odd years. And he lived on a farm, which is where my business partner, Bruce Baker, owned. And Steve being a solicitor in the city, Bruce being involved in aged care, Bruce was still a client, and I met Bruce Baker that way. And we eventually bought out the 35 other shareholders of Mareeba Aged Care, and we bought it in 2003.
Oh, it's interesting you've got a law background. I can't remember who I spoke to, but they had a law background and went into aged care. Does that help you sort of navigate your way through the ever-growing regulation landscape?
Um, the thing about doing a finance degree and a law degree, as I've said to my children, there's not a day goes past that I do not use something that I learned in those 5 years at university on a daily basis. It was wonderful training for any sort of business, not just being a solicitor.
I suppose that's the whole idea of education, isn't it? Like educating you for life rather than specific things. So,
I think you hit it on the head there, Danny. Yeah.
and also very forward thinking of your family, who's obviously a entrepreneurial family, to go into something like aged care that long ago.
Yeah, well, they were kids when they left school at 15 because they did the leaving certificate, and university was beyond the capabilities of either of them to be able to achieve. And if it wasn't for the scholarship schemes, I probably wouldn't have gone to university. Good old Goff, halfway through the double degree, made university education free. And I'm a bit of a socialist in some ways. I think that education and the Medicare system, they should be free. In that, we all pay through it, with our taxes, but there shouldn't be any bar to people being educated or receiving hospital care just because they can't afford it.
Coming from that business background, how do you feel about government regulation in aged care? Is it too much or is it about right, do you think, as it currently is?
I I think it's way too much. I go back to the system prior to the government being involved in aged care to the extent that it is. In 1972, when the Labor Party was in power, um, aged care was prior to that, aged care was a cottage industry, like convert an old house and you put some rooms in it and you have some beds in the rooms and you have a shower down the hall. The people who inhabited Clermont in the 60s, some of them were still driving down to the club to have lunch and driving back. It was a very different environment. Um, and in those days, they had about the same occupancy as a good hotel, about 70%, which was
Mm.
average across the industry. And it was quite expensive because they had a lot of bad debts. People wouldn't be paying for their accommodation and their meals and things. And it was expensive in order to set out the accounts because every person who was in aged care at that time, they did receive money from the Commonwealth, and that went direct to them. And the Commonwealth was writing out all these checks and posting them off to the individuals who would then put them in their banks and then pay the proprietors of the aged care. And we were also, my parents were chasing money. I was still at school in 1972, or first year at law. Yeah, first year at law. Anyway, the government came in and basically realised the cost to them of licking stamps and writing checks was ridiculous. So they came to the industry and asked whether it would be better if we just gave a check to the individual facilities. The industry jumped at it because it resolved their bad debt issues. And the Commonwealth jumped at it because it saved them a lot of cost. So from 1972, they also brought in that if they were going to provide the money to the proprietors, then they would take a bit more control. And we had in those days what was called an LH19, a cost reimbursement form that you filled in at the end of every year to be vetted by the Commonwealth. So this is what was spent on aged care, and they adjusted the fees accordingly for the following year. But it was always behind the times. Over the years, the Commonwealth, every time they were starting to run out of money, they'd squeeze the return to aged care, so that by around about 1990, there was very little in there for accommodation costs to be reimbursed, and there was just enough to cover the fees of running the place. And they were able to squeeze the industry to that point where a lot of them were going broke because they didn't have the money, but they insisted on having the control. And the problem with the industry right now is that there's plenty of clients. They're the ones who inhabit the beds. They're the ones who receive the home care packages, but there's only one customer. And that one customer controls your income because they set it. They control your costs because they have a national wage case every year. They control your costs because the increase in compliance means you have to have a hell of a lot more administration than we used to in the old days. And they also control your occupancy. So in COVID, they were announcing that they were giving out $500 million in extra aged care home care packages, which they knew they never had to deliver. They had the money, but they never had to deliver it because there's just no staff. So we had to close a couple of wards down during COVID because we couldn't get the residents in, we couldn't get the staff, and we had to save on cleaning costs and that sort of thing. Since then, it's the occupancy, has increased to the point where I was looking at the news the other night, and there's 2,000 aged residents in our public hospital scheme who should be in aged care, so they're bed blocking.
Is there a way to, this is a big question, but is there a way to reduce the government regulation and involvement and sort of allow the free market to do what it does? Maybe a premium offering or something with less interference, where the wealthier people can just pay for what they want and not have the government involved?
Well, that is the case right now. You can have an aged care facility with no government involvement because there are facilities around that do not accept the government subsidies. So the residents there pay for everything themselves.
And what are the outcomes there? Because in theory, it sounds good, like a good way to go.
Look, there's very few of them in Australia, but in order for them to have business, they've got to provide a pretty good product.
Yeah. They're not going to get much business if
No.
they don't have the regulation and don't meet a high standard.
But there's lots of ways that the government can save money in relation to the cost of aged care. They should means test it better than they do. People who've got more money should be required to pay more. They should allow retentions for the aged care proprietors from the RADs, like they used to have with the bonds. So we do a hell of a lot of work administratively without getting any reward for it. And we have, it's a competitive labour market out there at the moment. Even I could get a job.
That's modest.
Not that I'm looking for one in particular.
You're probably looking to move away from that.
Oh yeah, I'm looking. The amount of stress, as I was talking to somebody yesterday, when I had several aged care facilities, dry cleaning businesses, commercial laundry, and lots of staff, up to about 400 at once. It wasn't as stressful or as time-consuming as this one last aged care facility that I've got. Wow. Because of the amount of compliance and the amount of regulation, and the workforce has changed. There's more expectations. The costs are huge. And again, we don't control our fees. So when the superannuation goes up every year, which it should have been, our staff deserve to be paid better than they are. It's just the economics of it are that we're not getting enough money. So if there's ways for us to reduce the costs to the government and have the user pay a bit more for what they're getting, I think that's a good idea. But government won't let go.
Yeah. There's a difference between having an idea on paper and then implementing it, and then there's always an unintended consequence.
Yeah.
And I would understand that would be the case. It would be a headache, and it runs up the costs, obviously, too. That it's good to have an ideal view of things, but there's always another thing on the other end of that.
Well, Ken White, who was the aged care minister before the Royal Commission, said that we don't need a Royal Commissioner. We know what's wrong. Let's not waste $70 million. Of the three commissioners, I think one unfortunately passed away prior to the report being handed down, and the other two couldn't make a joint decision. They were at each other's throats a lot of the time. But they came up with an idea that it should be mandatory to have 24/7 RNs. And like my business model, we've always had 24/7 RNs because the facilities have been able to afford them. And as I say to everybody, if it's not good enough for my mother, it's not good enough for anybody else's. So we've got to do our best with the resources that we have. And we have to have, there are mandated minutes now as to how many minutes for nurses we have to have per resident. And anybody who's worked in aged care knows that these mandated minutes are ridiculous because you've got some people who need them, some people need more, a lot of people don't need anywhere near that amount of minutes per day. And there are a lot of small aged care facilities that are run by communities, churches, charities, private enterprise in the bush that are closing down. Now, in the bush, which is where I am, government set up these. They decided they would set up aged care in the bush during the late 70s. And the reason they did that was to unblock the public hospital beds with aged people who were occupying beds that could be better used for acute care. They would keep employment in the towns to stop the migration of youth going into the cities. They would support local businesses to keep them alive, which is what we do. And it would mean that people who went into aged care could live in their communities and their families around them instead of them being sent to Brisbane or Melbourne or a big city. Now they're closing them down because there are lots of small facilities of 35 beds who have wonderful reputations, but even if they could find an RN to be on deck, they would need a roster of 10 RNs to cover 7 days a week, 24 hours a day, and it's just economically impossible. And they're closing down, and I've spoken to lots of them, all over the country because I'm involved in the association and have been for 45 odd years. Steve, I'd love to put an RN on. I can't find them. We're going to be forced to close because I will not will be sanctioned because we can't supply the minutes. We can't supply an RN. We've got plenty of support in the local community. There's one recently in Mirror. It's run by the local council up there in the Hunter. They've an 18-bed facility. It's full. Lots of support from the local residents. They support the town. They give employment to the town. But the council's run out of money. It's costing them around about $500,000 a year just to keep it open. They cannot find an RN. They can't afford to find 24/7 RNs. They can't afford the mandated minutes. So this otherwise really nice aged care facility of 18 people, they're going to close it down because they can't afford to keep it open. And that's ridiculous. It was operating perfectly for, 40 or 50 years.
Yeah, the one size fits all approach just doesn't work in
No.
this case. It's too much of a
Yeah.
big issue, and chasing the ideal, you sacrifice the good that's already there. So it's not not a great approach, not a great thing for anybody.
No, and the bureaucracy is huge and it lumbers along, but they don't get out and see what's actually happening often enough. We've got a great facility, but I'm getting out because A, of my age, B, I've got no succession plan, and C, the amount of compliance means I'm the back office, and look at me. I wanted to stop before they actually put me in one of the rooms.
Go from operator to resident.
Yeah.
Yeah, well, that's a real shame.
Yeah.
Apart from everything that you covered, which is a lot, what do you think are the biggest challenges? Do you think it's workforce at the moment?
The biggest challenges at the moment, it's always funding because the government's got limited resources. So they've got to look at different ways of being able to raise money to, everybody complains about our healthcare system, but we've got a wonderful system. But like every system, there's some good things and bad things, and there's some things that need to be changed. In this case, the funding model has to be changed, and they've changed this about 10 times since I've been involved. They have not trained enough frontline nurses, and at the moment, because of the mandated minutes, we're bringing people in from overseas as RNs, and we have houses around our facility that we've bought to be able to have them for staffing accommodation, because where we are in the Northern Rivers, there's a less than 1% vacancy factor for anybody who wants to rent. So finding a house to rent, let alone buy, is impossible. So we've bought houses so that we've got RNs in there. It's just the overregulation um, and the lack of funding, which has always been the same. Don't get me wrong, I think the system's great in many ways, but it does need tweaking, and some of these issues are the ones that need to be sorted out. Workforce, housing for workforce, training people, and the costs.
That's probably a good place to leave it, Steve. I won't keep you too
Sure.
much longer. That's a really thank you so much. It's really good,
Uh,
great content.
thank you very much, Danny.